Well, the med spa industry has exploded in recent years, giving way to new business models that simply weren't as widely available maybe 5 or so years ago. There's so many different wellness services and products on the market. I tried a few of the most popular ones here in the Kansas City metro area and caught up with a local doctor to discuss the medical impacts.
Ready?
Yep.
Let's do it.
The inside of this chamber is just a few degrees warmer than dry ice.
It's negative 152. It's cold air.
Made popular by athletes who use it to heal their muscles faster, cryotherapy is now becoming more mainstream.
It's not painful at all.
Jennifer Pint turned to cryotherapy after 3 knee surgeries.
I was icing my knee on a pretty consistent basis, and I was taking like ibuprofen to manage the swelling and the pain. And I knew that taking so much ibuprofen wasn't healthy.
Now, 3 minutes in this chamber a few times each month has replaced her old pain management regimen.
The cryo being holistic and working from the inside out, I think is what makes it better, healthier, safer, and longer term benefits.
Former NFL athlete Joe Mays and his wife Toya opened the Leah Center in Kansas City about a year ago.
We do offer spa amenities, massages, facials, body wraps. We offer nutrition. We offer herbalism courses. We have yoga in place as well. We have our cryotherapy chamber here.
And business is booming, not only here, but at similar shops across the country. Centers that offer spa-like services, plus more advanced medical or wellness treatments, are in high demand.
All right.
Another rapidly growing wellness trend is IV therapy.
We have nurses that work with us and paramedics, as well as myself, and I'm a physician. We go to your home. We provide IV fluids and vitamins.
ER Dr. Meredith Leach started recovery hydration therapy in 2016. She says one bag of fluids can help with everything from hangovers to improving flu symptoms and migraines.
We have a cocktail of medications we use. One is for headache, one is for nausea, which often accompanies migraines. Then we mix all those things into your bag of fluids, and then rehydrating you along with all those is usually a perfect combination to kick it.
The cost ranges between $80 and $180 depending on the type of fluids you choose. The best part is they make house calls.
When you're so sick, you're not able to get up and go to a clinic and sit there for an hour.
Hannah Lessinger suffers from POTS syndrome, Lyme disease, and a host of other autoimmune complications. She says compared to all of the drugs she's taken over the years, IV therapy works best.
Instantly, I get a little jittery. And then, but long term, really the benefit of it is it helps subside the symptoms.
Dr. Leach says she treats a variety of clients, from those like Hannah with chronic conditions to athletes needing to rehydrate after marathons to bachelor and bachelorette groups seeking a quick recovery after a long night of partying.
Hangovers, it works amazing. You know, alcohol dehydrates the body. You wake up, your head's pounding, your mouth is dry, and you can't keep anything down. So we can fix it all within an hour.
Both IV therapy and cryotherapy have become so popular because they can help your body feel better faster. But how safe are these techniques? Dr. Chowdhury with Truman Medical Center cautions against choosing one of these treatments without talking to your doctor first.
If they truly have a deficiency that has been established by a doctor's office, in the sense that they have come with symptoms and we have done a lab test and that shows lack of vitamin, then we can talk about replacement.
He says research shows that the same vitamins being administered through an IV can often be taken orally, which takes less time and can be more cost effective.
There's no significant difference between the person who's getting vitamin the regular way and the IV way in terms of response to a condition they're treating.
Another concern about this rapidly growing industry is that it's largely unregulated.
That concerns me because what kind of oversight is in place? Again, if an infection incident happens with an IV insertion, who is liable?
As for cryotherapy, it's a toss-up.
The data is split. There are some studies that show, yes, within 24 hours, most people saw more improvement than as if you didn't use the therapy, so it's working. But there are studies that shows, no, not so much, and after 4 days, it's the same as if you were not using it.
And this doctor says if you're interested in these services or any new emerging wellness trends, do your research and ask these 5 questions first.
First off, they ask, are they close to any healthcare facilities should an emergency occur? Secondly, the staff that are administering the drug, are they certified to do so? Do they have a degree of, let's say, a medical assistant or a nurse or a doctor? How long have they been in business? And reviews, what are people saying? And then most importantly, if you are thinking about it, do run it by your doctor.
I tried each of these services and I can honestly say I noticed the most dramatic difference from cryotherapy. My muscles felt so much better, especially the day after I got the treatment. But standing for 2 minutes in negative 152 degrees was not easy. So a full session for most people is about 3.5 minutes long. Pat, Dominique,